Hey guys, welcome to Dear Pharmacy with Dr. Nini, and I am Dr. Nini, and I am a licensed and practicing pharmacist. And I'm just here to answer your questions and share medical information with you. I am not selling anything. This is not an infomercial. There are no ads or anything that I'm doing. I simply want to share some information with you and help you on your journey to a healthier life. So if you find this video helpful, please subscribe or press like or share. I would be grateful for that if you would do that for us. But today's episode is actually in reference to strokes. And I know you're wondering to yourself, why in the world is the pharmacist talking about strokes? This is simply to give you some basic information about strokes so that you have what you need to make sure that you and your family are nice and healthy. So, in reference to strokes, before we can get to strokes, what we really need to talk about are blood vessels. Blood vessels are simply the highways of your body that have blood traveling through them to deliver oxygen from one place to the other. Oxygen and nutrients going from the heart to the brain, to the lungs, to the feet, so forth and so on. When I start talking about those blood vessels and how healthy they are, there's a point when we block a blood vessel. It's sort of like having that accident on the highway. When I block that blood vessel and things get out of control, if that blockage happens to be in the brain, now we're talking about a stroke. So there are two types of strokes. There are thrombotic strokes, which actually happen to be a blood clot. That's what most of you are used to talking about in reference to strokes. You're usually talking about a blood clot that has blocked that blood vessel, and anything behind the clot can't get any oxygen. And that's when people start having damage to the brain tissue. And then at that point, when they have the damage, at that point, they actually start to show signs and symptoms of a stroke. The other type is what we call a hemorrhagic stroke, or it's a bleed. So in other words, the blood didn't stay in the highway. The blood moved out into a different area where it didn't belong, okay? So if I can't get the traffic through the highway, it's going off on different side roads, that means that the oxygen's not going to the tissue where it needs to go. And once again, we're starting to have signs and symptoms of a stroke. So what's really important for you to know is, first and foremost, what are the signs and the symptoms of a stroke? So the very first acronym I want you to remember is B FAST. B FAST. B-E-F-A-S-T. The B stands for balance. So my dad happened to have had what we call that hemorrhagic stroke. And the way that we knew that we had a problem was because his balance was off center. All of a sudden, he couldn't walk in a straight line. The doctor happened to notice it, that he just kept veering to one side. That's what we're talking about in reference to balance. The other thing could be that you stand up and you can't quite catch your balance. You're sort of off center. Look like those old You Need a V8 commercials. The other one is E, B-E. E is for eyes, okay? So do you have blurred vision? Do you have any type of double vision? The next one would be facial drooping. This is the one most people associate with strokes. In other words, does one side of your face seem to twist? My grandmother always used to talk about someone's mouth twisting. So that would be that facial droop. So that's the F of B, fast. And then there's A for arm weakness. So in other words, if you hold your arm straight out, does one arm tend to drift down? So that's your arm weakness. And then there's speech. Is this person coherent? Can they answer questions? Do they know what's going on? Lots of times they know what they want to say, but they can't quite say it. And then the last one is T for time. If we've answered these questions, and you don't have to answer all of them, it could be as simple as one or two. Okay? So for my dad, when my dad had his stroke, the main one was the balance. He was completely able to talk in sentences. In fact, he was calling us from the hospital, giving us directions. But at any rate, so what you really want to take note of is that you can have just one symptom, or you can have two or three. Just go get help, okay? So the T for time is call 911. But the other part of time is, if we're talking about that thrombotic stroke, a thrombotic stroke with a blood clot can be treated, okay? But I need to know, when was the last time we saw your loved one when they looked and acted normal, okay? I have 4 hours from the last time that we saw them looking and acting normal. That 4 hours allows us time to give them medications that we have available in the hospital to treat and reverse the signs and symptoms of that stroke. With a hemorrhagic stroke, I don't have the leisure of using that medication. It actually would do more harm than good. So our treatments and things are very different for hemorrhagic stroke. But I do want you to be aware that if I can get a patient in the hospital within 4 hours, if it's a thrombotic stroke, then at that point we can treat them. The other thing to take note is please do not try to treat this at home. This is a medical emergency. Giving a patient an aspirin if they've had a hemorrhagic stroke will make this stroke much worse. So please do not try to treat this at home. If you have problems, if you have concerns, consult a medical professional, call 911, okay? Thank you so very much for joining us for Dear Pharmacy with Dr. Nini. If you have any questions, please feel free to email me at drpharmacydr@gmail.com. It's been a great pleasure. Stay safe and healthy.